recently, the World Health Organization said that since the pandemic, there's been a 25% global increase in the prevalence of mental stress, primarily anxiety and depression worldwide. So that's pretty significant. We're all experiencing. I'm experiencing. You may have as well, Catherine.
Mhm.
So we definitely, the non-work factors is COVID has definitely triggered an increase in mental health and mental stress concerns. We look at our current state today with inflation. People are trying to juggle a discrete income with rising costs. So there's some issues there. Of course, we have the social media aspect, which is always putting stress and strain on us. Do people like us? Do they not like us? But also too is there was an article that came out a couple of years ago in the USA Today that zip code is a big determinant of medical claims and therefore some of the ergonomic claims, physical and cognitive. So what we tend to find is there's more mental health issues in lower income zip codes. So we do have a lot of non-work factors about the connection with ergonomics and the rise in mental health, absolutely. But from the work condition is, every industry has had some stress. I think that'd be a fair statement, whether I'm a healthcare worker and I've suddenly now I have a hospital full of people I wasn't expecting, and how contagious are they, to a truck driver. The truck driver now, I have to drive longer hours, more days per week to help the supply chain, to a small business owner that's contemplating, I can't open, therefore I might have to close my doors or work with less people. So I think that there's that stress there as well. And the physical does manifest itself in the mental manifests itself in the physical. So I definitely think that, they're correlated. One position I'd like to take real quickly, Catherine, is as an engineer, one thing I understand is we talk about product design, we talk about process design. So regardless of any industry, all industries have a product. If you're McDonald's, it's your burger. Mm-hmm. If you're Boeing, it's an airplane. If it's Procter and Gamble, it might be diapers. But when we look at that, is if companies have great ergonomics and great engineering, and we have good product design, so it's simpler to put together, it's easier, it's faster to do, or if we have a good process, if we actually set up our manufacturing or our delivery process, if we're in healthcare, to be simpler and easier, then guess what? We tend to see a reduction not only in the physical claims, but we tend to see less mental stress claims as well. So there is a strong correlation between the two that I think we as ergonomists can definitely affect.